A few years ago, the American Heart Association launched its first impact fund to help support community-based solutions to help improve health equity. And the association wants to keep investing in local entrepreneurs and organizations putting in the work to bridge that gap. This afternoon, Mindy Hartwick is here with us from the American Heart Association. Glad you're with us. Good to talk to you.
Yes, thanks.
Tell us about the program. So, first of all, we recognize that heart disease is like the leading cause of death in Lucas County.
Yes.
And a lot of it is unhealthy eating choices. But gosh, you go to the grocery store and all the healthy food is expensive. Fresh produce is expensive. That's the stuff that's good for you.
Yeah, exactly. And that's really why this is such a focus for us, is because we know, with cardiovascular disease, a lot of it could be preventable. And it starts with healthy eating. It starts with lifestyle choices, but then also, economic issues. And so that's where the Social Impact Fund comes into play.
So you have federal dollars. Give me an idea where this money is coming from.
Yeah, so we are grateful for our wonderful partnership with First Energy and the First Energy Foundation. They are our sole funders for the Social Impact Fund. And so through this partnership, we do have a pool of revenue that we're able to actually directly fund local organizations and entrepreneurs that have very similar mission focuses as the American Heart Association.
So you've met with some organizations. What kind of organizations have you had a dialogue with, and what would be the way they would use that money then to help the families?
Yeah, so the great thing about this fund is that it is direct funding to them. So it's not a typical grant application process. The organizations that we are looking to fund, they have three main kind of mission focuses. So food security here in the community, access to health care and making sure that that is access and health equity across the board, but then also economic empowerment. So those are the organizations that we're really looking to invite to apply for these funds. If they have anywhere in the realm of those being their primary focuses.
Well, you're talking about it, the medical part of it is very important too, because maybe you don't really take good care of yourself with the food that you eat, but if you go to the doctor and say, hey dude, your cholesterol is really high, or you got a blockage, that's a real alarm for yourself that I need to change some ways, convince myself I need to find a way to eat better and take better care of myself.
Yeah, well, and unfortunately in some of our under-resourced communities, those are all barriers, right?
Sure.
And so we are really trying to break through those barriers. The American Heart Association, we are very much focused on championing health equity. And so that's where this partnership comes in, and we're really trying to fund these organizations that are doing the same.
So what are you hoping to accomplish here in the next 6 months to a year with this?
Yeah, so we actually are accepting applications for the funding now. It closes next week though. So the 23rd is the last day to apply for funds. And anybody can apply. So they can go to our website, learn a little bit more about it. We hope to have all those direct funds in by the end of this year.
How much money are we talking about that's going to be distributed in the community?
Yeah, well, we actually have a pool of up to $200,000.
That's great.
It is, and I believe that that's going to hopefully help some of the organizations that are already doing amazing work in the community. Just give them an extra little resource and help there.
And we only have a few seconds left, but food insecurity is a problem around this area. 100%. So if we can solve that and then make sure get healthy food in people's hands, then it's a win-win thing.
You got it. Absolutely, yes.
Mindy, thank you so much for being here today.
You're welcome. Thank you.